and they have these 3 ligaments that hold the bladder intact. And then the vesical arteries, you can see here, the vesical veins run with those in the lateral ligaments. Now today, what I was talking about, those umbilical arteries, those you can see continuing up here. See this up here? That's the umbilical arteries, which will go up to the body wall, the belly wall, and go out to the umbilicus, the navel, in the embryo. Now, if we look at the major features of the uterus, these are all little placental packages here, parts where the implantation has occurred and the uterus has expanded for the kits. And up here, let me see, it's easier to see on this one, really makes the ovary look tiny. Here's the ovary right here. Now on this ovary you can see the ovary sits in that pouch. See that little pouch of mesentery? That's the infundibulum. And the infundibulum forms a little basket around the ovary. And the edges of the infundibulum, and you can see them here, see that little frilly-like edge on the rim? That's the fimbria. So the fimbria is the edge of the ovary, and the fimbria actually kind of wraps around the ovary and helps to capture the eggs as they're ovulated. When the eggs ovulate, and on this ovary you can see some corpora lutea, where the eggs have been spit out. As the eggs ovulate, they're caught in the fimbria and collected in the infundibulum, and then the infundibulum leads down to the uterine tube, which is right in the back here. See the little coiled tube in here? See this tube running right through the mesentery? And that tube dumps into the uterus, and usually, like in humans, somewhere down that tube is where fertilization occurs. So the sperm are inserted into the vagina, they travel up through the cervix into the uterus, and then they pass up the uterus to that uterine tube. Fertilization occurs there, and then the fertilized egg, the zygote, travels down and implants in the uterus where these have implanted. Now here you can see, because it's pregnant and everything's enlarged, the vasculature is really clean also. And so the gonadal arteries and veins that they talk about generically are illustrated here. And these are the ovarian artery and vein. You can see those here running out to the ovary and the uterus. In the male, that would be the testicular artery and vein, and they go down to the inguinal canal to lead into the scrotum. Around the ovary and attaching to the uterus, it's been kind of cut here, torn here, but this is the mesovarium, and with the uterus, what do they call it in here?
Mesometrium.
Mesometrium. It's a continuous ligament, and the mesometrium is this large portion that attaches to the uterus, and this is part of the dorsal mesenteries I was talking about today. And then at the ovary, it's the mesovarium. And then the end of that is the suspensory ligament, and you can see that suspensory ligament right where my finger is here. See it attached to the ovary? And if you think about it, in the humans, the ovaries would be suspended from that end of the connective tissue. Now, they also talk about a mesosalpinx, and the mesosalpinx is that portion of the mesentery that attaches to the uterine tube. So I've got the uterine tube in my forceps, and this connective tissue, the mesentery that attaches to that is the mesosalpinx. And so again, you can't see a distinction between those, it just depends which organ they're attached to. Okay, now I think I'm going to kind of liberate the bladder here. So we can pull that off to the side. With the bladder, I've exposed down through the pelvic outlet, and you can see the urethra traveling down. There's a lot of connective tissue in here, so I haven't really cleaned that up much, but I have opened up the vaginal vestibule by cutting the perineum. And in the vaginal vestibule, you can see the labia are located right around the rim of the vaginal vestibule, and also running down through here. These would be the labia minora and the labia majora. And unfortunately, the clitoris is right in the midline, and it would be right in here. And this isn't real clear. It's difficult to see in a cat. It's really tiny. And you can't see it where you are, but you can come by and see the opening of the vagina is pretty large in here. And the tip of the forceps are back in that opening now, which is unfortunately filling up with fluid. And the urethral orifice, I'm trying to see if I can see it from here. The urethral orifice will open up into this wall just ventral to the vaginal opening. And so this is a common area for both the excretory and reproductive tracts, and so that's the vaginal vestibule. Okay, if we look at what I want to do is probably we'll cut down the uterine wall here and continue that cut on this side of the body of the uterus. Make sure I don't cut off any fingers or anything. Little pause.
How big would the uterus be then if it wasn't filled with little cuts?
About the size of this,
Really?
the body right
It
here.
looks like a pigtail, like it's little.
You have a growth hat?
Yeah, but ours is big too.
It's just a bit
You have a
thinner than
pregnant
that two right there. You see that
Oh,
orange thing? It's thinner.
how disappointing.
Either poster.
No little face or anything.
Are they still mush?
Yeah. Now there's going to be a lot of extra embryonic tissue along with them, so I'll peek. Not much.
Baby is born. Not as cute
Little
as I thought it would
C-section. No, no. And none of the ones I got were really big, so.
Yeah. Yeah. Cause that's
It's
almost
like
what was in
hamburger.
ours.
Ours is just like the
Cafe.
And ours
way
was
the
super
blood,
dry.
the way our blood.
So did Brian want a little afterbirth?
Don't yours ever get yellow after a while?
Mine do.
Yeah.
After seeing that, our cat was
think our cat
definitely
is
pre
diseased.
too.
Yeah.
It spits at yellow stuff at us.
Mine was doing that the other day. I don't know what I was doing.
It might have been the stronger solution and stuff too.
Yeah, go stick your hand in one of the buckets back there.
I like your shoes.
I was just checking those out.
This is how
Good.
Yeah, a little rough.
No, the ogre said that.
Yeah.
Origin.
It's probably about your height.
Right now.
Probably like Shaq or something.
Oh, sorry, Doc.
That's okay.
Like the duck
I'm
version.
gonna go and smack him on the head.
Down.
Okay. Now, it looks like this is the cervix right in here. And it's just muscular folds. And you can't, unfortunately, with the cat uterus, it's not really obvious. But it's going to be, you can see these little muscular extensions, these folds into the lumen. And here it's just, this is the vagina in here, and this is uterus in here. And so this right here is the cervix. And then it just forms a projection of the uterus into the proximal vagina. Okay, that's about everything.
That seemed way less complex than the reproductive system.
Well, you don't have the tubes. You don't have the tubes, and with the male, tomorrow what I'll do is I'll cut a male, and we'll dig back in the pelvic outlet like that to
See the
see if we
bones.
can see the glands, identify all the glands.
Oh, I think I see an eyeball maybe. Was that an eyeball? Like, was that his head? Do you see what I'm saying?
His head?
Her.
You can see a lot better than I can.
Ball right
Could
there,
be.
maybe?
Go soak it in some water for a while.
I'm probably just
Looks like a
seeing
little
things.
chicken egg.
You should cut open the other side.